This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. Good to be back with you live here in the studio for our weekly edition of Health Watch. Every Sunday, 8 till 9, Talk Radio 1210, WPHT, as the man said. And as always, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always, open lines in the studio, 855-839-1210, 855-839-1210. What do we talk about here on the show? We talk about everything pertaining to you and your family, improving your overall quality of life, and we do that with Dr. Molly, as I said. We'll do the who, what, when, where, why, and how, Dr. Molly of Innovative Medical Associates.
It's great to be back and live in the studio.
Right, and we have the hottest day of the year.
That's okay.
And later on, you're going to tell us about a sunblock you're developing.
Yes,
so,
sure. I mean, it's all good.
It would figure that Dr. Molly is developing something right in the time of the year that we need it.
I hope so, John.
Okay.
I hope so.
All right, 855-839-1210. We always like to start off with kind of an overview of what Innovative Medical Associates is all about. So tell us, what's it all about?
Well, what's it all about? You know what, John? It's so hard to really talk about Innovative Medical Associates. It is a group, a cooperative of like-minded healthcare providers who all work out of my facility, which is Associates in Preventive Medicine. We are a licensed primary care facility, which means we can do anything anybody else can do. If you go to your family doctor, you need an antibiotic, we can give it to you. You need to get some x-rays or radiology of any kind, we can get it. You need laboratory services, we got it. Okay, so we can do all of those things, but our focus is on utilizing hydration therapy and utilizing natural substances to help a patient reduce their need for prescription med, thereby really eliminating some of the side effects. Now, with that being said, I say don't throw away your blood pressure pills,
That's
folks.
Right. That's right.
I'm saying let's see what we can do to augment those, and maybe you can reduce one or two of them. And that's really a positive thing when you think about it.
We've often talked about side effects.
Oh, there are many.
And how many times, again, this weekend watching TV, well, don't take it if you have this or you have that. And this could do this and this could do that. They spend more time on saying what it could do,
right,
what a potential side effect is. So your goal, your emphasis is on reducing the side effects.
If we can.
If you can.
Right. And helping the patient still manage the condition that brought them to the pharmaceutical in the first place. Now, that is not an easy task to do. It takes some time from the patient, but hydration has been the most effective way to do this.
And when you say hydration, it's like when you go to the hospital and you go to get
first
surgery.
Thing they give
first
you.
thing they do, put an IV in.
Right,
So
right.
This is what you do at Innovative Medical.
Right.
And in the hydration,
we put in natural substances. So, for example, if you have hypertension, we might want to put in a little arginine. Depending on what you're there for and what can we help you with. And the bottom line is what? We believe we're going to improve your quality of life, regardless of your medical condition. I'm a big believer in that, John.
And here's the $1 million question, which you get at every consultation.
I know.
Dr. Molly, you talked about arginine, you talked about this and that, but I go in the health food store and I buy that.
Yeah, you can buy it, but are you getting enough of the product? Are you getting the purity of the product? Is it the right product for you? By the way, arginine is not the only thing you need. You might be using niacinamide. So there's so many things. What goes into this is the art of the IV. That's equally as important, and maintaining safety for our patients.
We should mention also, Dr. Molly, many times you and your nurse, Barbara, and your staff have recommended for me and others
sure.
to purchase some supplements.
Sure.
and I've done that.
Right.
I think right now I'm taking 9 or 10 supplements.
Of course, you have some
Exactly.
difficult conditions.
Exactly.
John.
So the point is that you're not against that, and
No,
you
no,
do
no,
recommend
no.
some.
Yes.
But that's sort of like what it says, a supplement.
Exactly.
The hydration is the main carrier, correct?
The hydration is the best way to deliver an appropriate dose to actually help do the job. I guess that's the best way to say this. To effectuate the change, you need an appropriate amount for the patient. And when I say appropriate, I mean just right. Okay, you hear me all the time talk about Goldilocks. I don't want too much. I don't want too little. You'll never get what you need done.
For the hydration, how much is enough? Like if a patient comes in for the first time.
Well, generally, it depends on the condition, John, what we're doing. I mean, you see I have several cancer patients. So,
Yes.
I don't expect to see any effectuation in their challenges and their improvement in their quality of life, more importantly, especially while they're going through chemo, unless they do at least 20 to 30 or 40 treatments. And some cancer patients are going to be lifers.
And there's some, like myself, who have been there for 20 years.
Exactly.
Right,
Exactly.
who just keep on going.
Well, you're all about what? Looking good as well as feeling
Right.
good. So if we talk about regenerative medicine, which we'll do later, we talk about what? Anti-aging on a cellular level.
Yes.
That's what you're doing. You're
Right.
protecting yourself on a cellular level.
Yeah, well, listen, at 71, I gotta look like I'm 51, right?
Well, you do. Is 70 the new 50, guys? I don't know. I'd like to hear from some of my patients out there.
So if someone can come into you for the first time for your initial consultation, what can they expect in terms of getting started? Is it the 10, the 15, the 20, or
Well,
is
listen,
it like
John.
a maintenance schedule later on?
Well, yeah, I think what they can count on is that they're going to have to at least take 10 treatments, depending on where they are in terms of the hydration. And more likely, they may need 10 to 30 treatments. It depends on what we're trying to effectuate the change. Obviously, the longer you've had the problem, let me ask you, you go into your doctor, he gives you one prescription. You think that does the job? If you have a diabetes, you think you only get the one prescription one time, or are you renewing?
You're renewing.
Amen.
Right.
So it's the same thing with this kind of stuff. We really got to look at how do we get to the quality of life issues to make 70 be the new 50.
And you would recommend, I would think, like myself, that you're going there and you just keep going.
Well,
So
try
you want to keep it going.
Look, I don't necessarily want to go steady with someone, John. We can bring you down to once a month, once every 6 weeks. It really depends. But I can tell you get the biggest bang for the buck when you do a series of the particular treatments. And in particular, when we look at men's health, there's an area that I'm going to show today how well it did in as little as 5 weeks, doing it the way we asked them to do it.
Yeah, we are going to talk about your men's health protocol, and actually your patient gave you permission to
Yes.
discuss it on the show.
Right.
And you showed me, and it was like the results are amazing.
It is.
What was that, 5 treatments?
Well, actually, it was 5. It was 5 treatments on the acoustical wave, but it was 10 treatments in utilizing the hydration portion of it, and I will explain all that.
Yeah, it is
It's
amazing.
an interesting
Yeah,
thing.
it really is an interesting case. Coming up on our first break of the morning, it's called Health Watch. That's the name of the show, and we're here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates in Marlton, New Jersey. 855-839-1210 is our number here. Perhaps you have a medical challenge you want to run by Dr. Molly, or you have a simple question about any of her protocols that we've been talking about so far, or anything in general. 855-839-1210 with Dr. Molly Fantasia. I'm John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. As always, when we're on the show, operators are standing by at Innovative Medical Associates. You can contact them if you want some more information or you want to make an appointment with Dr. Molly. That's the best thing you can do. 856-489-0505, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com. That is the website. A lot of good information on that as well. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. The number right now, if you have a question for Dr. Molly, 855-839-1210. We made reference, Dr. Molly, to regenerative medicine earlier.
Right.
And I know you wanted to talk about this.
Sure.
It's what it sounds like. It's like it's regenerating some cells.
That's right.
That's what it is?
Right.
Okay.
Look, if you look at one of my products, you see it. It's going out like crazy. On the label, it says stem cell. And on the label for cosmetics, I can put that because it definitely helps regenerate stem cells. But when we talk about it in terms of the medical facility, we have to use something like regenerative medicine, which is technically processing molecular and cellular biologics. Okay, the extraction means a natural human live birth product that actually can restore normal cellular function. And it may even grow some new cells. Now, that being said, how do we accomplish this? Well, we accomplish it through hydration, utilizing an IV therapy that actually delivers this regenerative medicine product through IV, and it then can help eliminate symptoms as related to what? Arthritis, joint disease. It can help with wound healing. Now think about that, John. Wounds, burns, and how does it work? 20 years ago, they were using a pharmaceutical product that was extracted from live platelets, John. Live platelets. Those are the things in our blood. They're little tiny cellular proteins in our blood that promote clotting. Okay? So things have grown since then.
Yes.
So the goal of restorative medicine or regenerative medicine is to help our bodies utilize its own properties for the healing of a particular challenge. So, for example, right now, COVID-19. Listen, regenerative medicine doesn't cure COVID. Let's get that right out, okay? However, have you noticed that there are more and more people who've had post-COVID problems with their lungs? And in particular, those problems might have had COPD, asthma, lung issues prior to COVID, right? Well, it's an interesting thing because I just read an entire textbook on this that has just been published about 3 weeks ago, talking about the utilization of regenerative medicine through peripheral IV, venous IV, exactly the way we do it, and how it works on the lung tissue. Is that interesting?
That is very interesting.
And I've been doing this for over a year for our patients who have COPD and very bad cases of asthma, et cetera, and lung conditions, emphysema included. So we've been doing this already.
This is fascinating. It really is.
It is. And why does it work? Because it goes through the venous system that goes to the heart, and then from the heart it goes through a capillary network, which is the smaller vessels, and it works on the lungs. And what does it do? It can decrease inflammation, which I talk about all the time, and it may even regenerate some scar tissue, knock it out so that new tissue comes in.
Is it like, let me see if I understand this.
Oh, it's hard to understand.
Is it like, let's say you're talking about a COPD patient.
Right.
So they go through this regenerative medicine.
Right.
And at the end of the treatments, is it...
They would have improved lung function.
So it would be
capacity.
like they were before?
Well, I don't know if I could get them to 20 because the lung patients that I have done in the past have been somewhere the average age about 74.
Okay.
But they couldn't walk the distance of my clinic, and when they were done, we sent them out for pulmonary testing, and their pulmonary testing improved more than 45%.
So we can define this as regenerative medicine regenerates through the use of
These
cells.
cells, that's
cells.
right.
It can regenerate them to get them almost back to where they were.
Right, at a certain point in their
Right,
life.
right.
Maybe not at 20, but certainly maybe
Right.
at 50,
Okay.
55. Now, here's the interesting thing, John. When we do this, you have to understand that our protocol then actually prepares the body for these particular biologics or these cells. How do we do this? by the use of hydration prior to giving this, a course of hydration with specific nutraceuticals that help improve what? The powerhouse of the body, which is the cellular, right, output. So you see, it's a little convoluted, and then you hit it with the IV of the regenerative substance.
This almost sounds like an episode on the Sci-Fi Channel.
I know it does.
You know, it really, it's
does.
so interesting.
And again, we're doing this differently than a lot of other places in that I'm using hydration number one as one of the cornerstones to prepare the body to receive the more expensive, quote unquote, hydration delivery of these cells.
Is it like you're mentioning COPD? But
COPD,
are there
emphysema,
other things?
Sure. Oh yeah. We've used it extensively for some folks who just want overall anti-aging. They want to improve each and every system. They want to improve the powerhouse of the cells. So in my mind, the best way to do this is to what? Reduce inflammation, use of the cytokines, which is one of the proteins in the mixture that we deliver, and help a patient's own cellular function come back to being an optimal level.
So back to 71 wanting to look 51. This can help me do that?
Yeah, and then I would tell you to get a bottle of the stem cell preparation that we put together,
Okay.
which isn't that expensive,
Right.
as you know.
Exactly.
But it's a twofold process, if you see what I'm saying. So our treatment isn't bang, you just come in and receive the new cells. We don't do that. That's not enough from where I sit, and I can prove it with some of the data. What we want to do is look at improving and preparing your cells to accept these particular cells that we are giving you in a way that will help the body move and heal itself. Another example, we've used this in congestive heart problems. And we had a patient who started with us with an ejection fraction around 15 or 16, maybe less than 20. In fact, we've had several. And by the time we were done using both the regenerative medicine substances and our hydration substances, and by the way, this was a period of time of about 4 months. In the end, he's doing very well. And by the way, he had COVID this year. He had COVID,
Wow.
and he's doing well through it.
Yeah. I wanted to ask you, as far as regenerative medicine, you see a lot of ads for this.
Sure you do.
And I guess the question is, because I know you and I know that you do it differently than others.
Yeah.
So how do people know that they're getting quality, that they're getting the right thing, the best thing?
Well, you know what? I pride myself. Remember, the lucky thing about being in our facility is not only do you have a physician there who is very intelligent in all the new protocols that are out there, but you also have a PhD level scientist who takes great pride in preparation of a product, research of a product, and delivery of a product, and that's me. We've got the best. For example, our platelet-rich plasma. I have one of the best centrifuges out there, which means that the yield, which means the amount of platelets and growth factors in the substance that we inject for the patient, it may be higher than other places.
That was my question, because you and I have talked about this on the show, and we've talked about it in private, that you see all these ads for regenerative medicine.
Look,
and
you feel like you've walked into the land of Brigadoon. I come in at 70 and I go out at 20.
Yeah.
Let's be realistic, John. My whole thing is improving your quality of life, no matter what age you are, and helping the body actually move its own systems into operating at an optimal level.
All right, we're coming up on our halfway point of the show, which means we have plenty of time to take your call. And we always ask you, if you're going to call now, because we don't want to get you shut out. People call at the end of the show, and then we can't take you because we have to go off the air. All right? 855-839-1210 is the number, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We have plenty more to talk about here on the show, including some fascinating results for a patient in Dr. Molly's men's health protocol, and we'll talk about that after the break and whatever you want to talk about at 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia. We return. More of today's Health Watch after these words. We are back here on Health Watch. Operator standing by right now at Innovative Medical Associates, and the number 856-489-0505. 856-489-0505. And you're saying, well, why would I call the operators right now? Well, it's very simple. You want to make an appointment to sit down with Dr. Molly, go over your particular situation? That's what you do, and the initial consultation is complimentary. Dr. Molly does meet with a lot of folks who listen to the radio show during the course of the week, so you could be one of them. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That is the website. And don't forget, if you miss any of today's show, you want to catch it again, or you want to hear it again, we have our Health Watch replay 4 until 5 this afternoon here on Talk Radio 1210 WPHT. We're going to the phones and talk to Carol in Edgewater Park, New Jersey. Carol, good morning. You're on with Dr. Molly.
Good morning, Carol.
Good morning. Good morning, Dr. Molly. I have a post-stroke patient, my husband, 77 years old, and he was put on, 3 years ago, he was put on stroke medicine, in other words, to lower his blood pressure. That was his problem.
Right.
And there must be some side effects to that medicine because he has totally deteriorated, doesn't want to walk, muscle tone is gone. He's very lethargic. He's very angry, and he's very, I would say, depressed because of his situation.
Of course.
And it's with anything that you're able to do can help these
Carol,
people.
can I ask a couple questions? Has he had Doppler studies in particular?
He's had Doppler studies that he
carotid?
has good circulation in the legs.
He does have good circulation. Okay, what about carotid arteries? Have they done anything on the carotids to make sure he's getting enough?
That, and they've also done his oxygen content is at 98%.
Good. Okay, that's very good. Well, I'll tell you what we can do. He's probably a great candidate, not just for the chelation that will improve blood flow from head to toe, at least 12%. That's body surface. But in addition, what I would do is I would look at giving him some nutritional supplementation in the hydration bag for brain function. Very important. And I can tell you one of the substances I would use is something called vinpocetine. Now, I really don't want you to run out and get that at the health food store, and I'll tell you why. I want you to be careful with it because it is an extract. There are many things we can do. The other thing is utilizing the B vitamins in a way that would promote brain health. I think that's where you have to go. Once we have the stroke, people really lose some portion of their brain function during that time. It can come back depending on how long ago the stroke was. When did he have the stroke, by the way?
It's 3 years, but I was 6 miles away from a stroke hospital, and I got in the TPA immediately.
Oh, good.
So all the paralysis on the right-hand side is gone, except for a little bit of a ducky foot when he gets tired. But it's the mental thing. He has no ambition, and he has no and I know what it is. It's the medicine that's depressing his blood pressure.
Of course.
Because it's making him a vegetable. He just wants to sit. And
you're
sitting is the next.
Not good.
Yeah.
You know what, honey? You are a great candidate. Bring him in. I'm not that far from Edgewater. Come in for the free consultation. We can help him. He needs to meet my wonderful nurse, Barbara, who is, I won't say how old she is, but let's put it to you this way. I'm 73, and she's in that ballpark. And she herself had a stroke, and I will tell you, is her cognitive function unbelievable, John?
Yeah. Oh, absolutely.
I'm
I
telling
would
you,
say so,
she's
yeah.
still reading fully. She's fully engaged. In fact, I couldn't even run the clinic without her. I'm telling the truth. It's so wonderful.
good.
Are you a registered nurse by any chance? Because you really understand this problem, I'll tell you that. Just
No,
as good
I've
wife,
been
right?
organic since I was 14 years old.
God
And
bless you.
I've been the farmer's daughter on a farm, and I keep.
Yeah.
I
You're the
have an
best.
organic cafe, and I'm trying everything I do. My degrees in associate's degrees in nursery ed and geriatrics. So I'm using
God
all my
bless you.
geriatrics on my husband, but it's not working. He's very depressed. He's very unhappy. He's very angry.
Yes,
and you know
it's not unusual, but I'm going to tell you, he won't be like that when he sits in the chair in our office, because our group will not let you be depressed. It's a lot. I have to tell you, of all the clinics, someone came in and said, your clinic looks like a infusion clinic for cancer patients, but is so far removed from that in terms of what's going on in there. They
Right.
started to laugh and said, this is really what they should be doing at the hospital. I said, well, I don't have any control over that, but I have control over the clinic. So
Carol,
God bless you,
good
Carol.
luck with that, and
God bless
please
you.
call Dr. Molly
Please,
and
please.
get that initial consultation,
This
which is free.
Very
and
interesting.
that'll help you out,
Very
yeah.
interesting program. The other thing, he might be a very interesting candidate for the use of regenerative medicine. You know, I'm using it right now on the PSP patient.
Yes.
And that's an ebb and tide. You know, that's a condition, a neurological condition where there is no money being poured into research or any of that. So this has been an interesting case.
And we started the show by talking about side effects of medicine.
There
and
it
here,
is.
Here Carol is saying she really feels that that's what the problem is, and
Well,
it very well could be.
It could very well be.
Yeah,
And
so here we go again. You know.
Right. And again, I'm not telling them to throw away their blood pressure meds, because obviously you want to make it under control. But at the same time, you know, there is a school of thought. Now, I'm not a physician, I'm just a scientist, but there's a school of thought that says as we get older, we need even a little more blood flow to the head, you know? So it's a fine line. You've got to listen to your physician, but I have a great one in the office who can help us with
Yes.
this.
855-839-1210 is the number if you have a medical challenge or a question for Dr. Molly. 855-839-1210, our number here in the studio. We're going to start this discussion of the men's health
Sure.
protocol that Dr. Molly has developed, and it's really fascinating, and then we'll pick it up after the break, too. You have some results here from a particular patient.
That's right.
And you were showing me, because you have permission to do that.
Right.
And I'm looking at this and I'm saying, I mean, it's like almost too good to be true here, but it's true.
Well,
Talk about it.
I'll tell you one thing. Let's talk about the time frame that this is. He started with me May 11th of 21. He got these results on 5/27 of 21. You listening to me?
Yeah.
Okay. So here's the thing. This is a questionnaire that's been developed by a group, the International Index of Erectile Dysfunction, or erectile function, as really I'd like to say. So here's the thing. It starts out with a numerical scale 1 to 5. And he started with very low 1. And at the end, most of his challenges were at a 5, which is very high, and the rest were at 4, which is most times.
Now, I know you can't give away secrets.
No, I won't.
But how did you do this?
This was a combination therapy using the acoustical wave machine, which is being used all over with folks, but we do have a good one, and I can prove that because one of your other listeners, as a chiropractor, came in to take pictures of my machine so he could get it, which I said, get out.
Yeah, right,
anyway,
exactly.
Nonetheless, then he said he didn't want to spend the money. Okay, you know, the
yeah,
point
and
is,
you've used it on me. Your docs have used it on me.
yeah, I know that. So here's the bottom line. The bottom line, it's a combination. The use of the hydration therapy, using the chelation, using things that improve what? Nitrous oxide. Nitric oxide. That's very important because it does the vasodilation of the veins.
So that's why.
It's a combination therapy. So here we go again. What I talk about all the time, and I've spoken about this before. If you don't improve the blood flow, if you don't improve the neuropathy or the pain that you might have, the peripheral nerve pain, right, in that area, what's going to happen? It won't improve. So the combination therapy seems to work the best. It's the quickest, I can tell you that.
As opposed to, everybody knows about the little blue pill.
Yeah, yeah.
So what does this do that doesn't do?
The little blue pill absolutely opens up the vessels. That's important. But again, if you don't really work at correcting this, at letting the body come back to its natural substance, its natural place, you can't really look at that and say the little blue pill is not really, it's the solution, but it doesn't change outcome, is what I'm saying.
And that's what yours does.
What we're trying to do is change outcome and do it in a more natural way, a God-given way.
All right, this patient now is at...
He's coming back this week.
He's coming back. Where is he now? In other words, does he continue to do this?
Well, he may have to come in for some tune-ups. There were some challenges in terms of his cholesterol, et cetera, and that we still have to address. But the interesting thing, even with the lipids, even with the cholesterol, it has come down, but not to what we would consider a normal range. He's still doing very high on the erectile scale. That is very important. So think about it, John.
Yeah. We're coming up on our final break of the morning, which means we still have time for one or two calls if you want to jump in here at 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, executive director, and founder of Innovative Medical Associates in Marlton, New Jersey. And again, that number, 855-839-1210. We'll continue our discussion of Dr. Molly's men's health protocol and some other things, if you'd like, at 855-839-1210. I'm your host, John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, again, operator standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. You have some questions, they'll be happy to provide that for you. And most importantly, I want to sit down with Dr. Molly and go over your particular situation. That's what you do. You call that number, make the appointment. And as I always tell you, the initial consultation is complimentary. The number again, 856-489-0505. And the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. Don't forget, Health Watch replay this afternoon, 4 till 5. You miss any of today's show, coming back this afternoon, 4 until 5, right here on Talk Radio 1210 WPHD. We get a chance to listen to ourselves, Dr.
Yeah,
Molly.
that's right. You know, it's funny, right? When you listen to yourself, you always have something else to pick up, another little criticism or something about what you do.
Right.
And that's how we operate. I'm always looking at new. I'm always looking on how do we improve patient outcome. So can we get back to this patient?
I want to get back to this.
Men's health all the way
men's
around.
Health, yes.
So one of the other things, John, not just the acoustical wave, not just the hydration-driven nutraceuticals that are necessary for men's health or health in general, including improvement of the blood flow. But we may want to look at bioidentical hormones for men and how, of course, there are blood work involved, that kind of thing. So if a guy has low testosterone or he's converting his testosterone to a form, either a bad form of testosterone or an estrogen even, we have to work to improve those kinds of issues as well. And we do. So obviously our doc will prescribe a bioidentical testosterone for men in addition, and something that might modulate the estrogen conversion. So there's a lot of nuances for things. The other thing I get a lot of, and this is true for our young men too, they want to have more muscle mass, right? Now, we all know about the pointed head athletes who go out there and shoot themselves up with human growth hormone. Now, there are reasons to use human growth hormone, especially for children who have growth issues. That's the reason why it was approved. But there are so many other ways to help an athlete, a young man, utilize his own body to promote his muscle mass. For example, amino acids can do that. And I have an athlete right now who I know is going to become a star pitcher. I know that in the major leagues. And, he's very fussy about his body, and we want him to be that way. He comes in for your favorite vitamin C.
That's right.
And amino acids,
Right.
natural amino acids. Those things were important because he had to have a little problem on his arm, and he had to have a minor surgery. And guess what? We helped heal that thing rather quickly. So there are so many aspects to men's health. That's my point. It isn't just the erectile dysfunction. That's a symptom of other problems.
When you're talking about this men's health, and we've really kind of gone over it as much as we can here today without people coming in for the initial consultation, which is really where they get the information. But is it something that you're always going to have to deal with? I mean, in my situation, I've been coming and I have many challenges, but with this men's health, does it stop or do you keep going?
Well, it's a funny thing. As I said, one of the things that I was lucky enough to do was to actually be involved with the father of men's health, I like to call him, who's retired now, and we actually have some of his patients. Some of his patients were coming back for his protocol for 25 years. So is it the kind of thing? It really depends on the issue. If the issue is just lack of blood flow or broken blood vessels and nerve damage, that can be remedied fairly quickly, and then you just come in once a month or so to keep the vessels open. But if you have other problems that might mean the hormonal replacement portion, you might have to come in on an ongoing basis depending on what is the underlying cause of that.
So many men have this problem.
Oh, my goodness, yes.
And
yes.
a lot of times they just don't know what to do, or
Right.
they just do nothing because they don't know what to do.
Well, here's the other thing. You go to conventionalists and they say, oh, this is how you take your testosterone. You know what we like to do? We like to say, listen, we want to do this as close to the God-given way as we can. We want to help you improve your quality of life. And let's face it, sexual function is a portion of quality of life, and both for the men's patient and also I treat a whole lot of their wives. And so what we want to do is improve your quality of life no matter what.
There's we were talking about regenerative medicine before and about all the ads. You see all these ads now about different places that do different things. And I've had friends who have gone through them and they say, you know what, it really doesn't work,
Okay. I can say that in our facility, we will try to absolutely have you come out better than when you come in. And that is almost a guarantee.
Well, and that's all you can say, right?
That's it. And what we want to do is improve your quality of life and let you enjoy life in every aspect, men or women. That's what we want to do.
I want to get back to that patient you were talking about.
Sure.
How's he doing now? He's
coming in tomorrow.
I mean, is it?
And he says he's doing well. I spoke to him yesterday or the other day on the phone. He said he's coming in, but we have a few little challenges to tweak, and we're going to. We got to really focus in on the cholesterol, the lipids. I mean, we want to focus in on his cardiac health too, because without good cardiac health, how do you have stamina? How do you have lasting power?
Exactly.
Okay, the bottom line. So the point is, we want to focus on a whole body approach, which is what we like to do with all of our protocols. It's a whole body approach.
How would a man know if he's eligible or appropriate for your men's health protocol?
Well, he'd come in and talk to us, and we would see what are some of the underlying issues. He may have blood work that shows this and shows his hormonal levels, this kind of thing. He may have blood work that shows his cardiac status. Bring what you have in. Let's sit down, let's talk, and see if we can put together a plan. And remember, John, this is the overall plan. The wonderful thing about our clinic is we're able to customize a plan for you, regardless of what protocol you take. You know that's true. Every one of my cancer patients is getting a different nutritional protocol. It's true across
you're
the
able
board.
to adjust as you go along.
Exactly, exactly. And so what I want to do is urge everyone that one size of anything doesn't fit everybody.
And that's a good way to end the show because we're out of time. that's going to put the wraps on another edition of Health Watch. And don't forget, we have our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. Operator standing by right now. You want to set up an appointment to sit down with Dr. Molly, 856-489-0505, and they will be there well after we leave you at 9 o'clock, 856-489-0505. And check them out on the web, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, Joanne, Barbara, Delightful D, Fabulous Fran, and our nurses Jess and Crystal, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, the live version, 8 till 9, here on Talk Radio 1210 WPHT. You take care.